Parents and school officials are constantly amazed and shocked at the way young people invent new ways to find a high. It ranges from household cleaning materials to prescription drugs, and the latest abuse involves a drug that is readily available for students. They are nicknamed study drugs. And joining me with more is Ed O Reilly with the Neil Kennedy Recovery Clinic in Dublin. Welcome, Ed. It's nice to see you.
Nice to see you, Gail.
Study drugs, I have to tell you, that is a new one on me. What is it?
Well, it's actually just a new term to refer to something that's been around for a long time. Back in a long time ago in my day in college, we just called it speed.
Okay.
Okay. Now, it's a bit more sophisticated, the medication, so much of it is time release, but it's amphetamine-related compounds. And so it's pretty much used for the reason it used to be used, which is I'm not exactly budgeting my time to study well and maybe doing a little bit too much partying, and I have a big test tomorrow.
So speed, it hypes you up.
Yes, it does. It does. It's a stimulant, and it's a little slightly time-honored to kind of party too much, don't study enough, and try to compensate for it by taking stimulant medication. The thing that's different now is that ADD and ADHD it tends to be diagnosed more than it used to be, and so quite a few high school students and college students are on ADHD medication, and therefore it's more readily available.
So that is speed, really?
It is. That would be a fair statement. Now, it's not quite the same thing as, say, doing methamphetamine or something like that, but it is a stimulant medication. It is potentially addictive. You have to be careful with it. And of course, it also has the other side effects like any stimulant medication would be, in that if used excessively, it can raise your blood pressure and cause unfortunate side effects.
Things like, I would think, an arrhythmia in the heart,
yes.
Speeding it up.
Yes, exactly. It can do that. Now, normally in an otherwise healthy young person, that won't be terribly problematic, but if they have something that we don't know about, okay, then yes, it could be.
You know what's interesting is I bet college kids don't think a thing about giving their roommate a pill if they need to stay up, if they have, you know, ADD or ADHD, because they don't think it's bad.
Well, they don't. Part of the issue is that if you're on a prescription, giving your prescription medication to someone else is basically, from a law enforcement standpoint, is classified in the same category as dealing. Okay, and which is not a good thing you want to do. Now, it's difficult, I mean, to resist, say, a friend or a roommate or somebody who's kind of like, oh gosh, I'm terribly hungover, I really need to write a paper, you know, can I have one of your, you know, some of your Adderall, say? And it's like tempting, right? And it does indeed happen. Now, what some people argue is, well, these days when all kids are looking for a little bit of an edge, you get into a good school, you know, maybe if this helps them get their grades better. There have been studies, and the studies show that's not how kids use them. The way they use them is the way I just alluded to, which is I don't study very much, I party way too much, and I try to compensate by doing stimulant medication. Okay.
But I could also hear students saying, I don't use it very often, only during finals.
Well, yes, I mean...
So is it really addicting? Is it really hurting me?
Maybe not. Okay, the problem is it becomes a crutch, all right? And it tends to potentiate the other negative behaviors that I'm doing. Okay? And here's the way this works. What the studies show is partying too much and not getting enough sleep and compensating with taking somebody's ADHD medication is not as effective as actually studying.
So these are kids who are feeling the pressure and want to do their best. They're kind of the slackers.
Right. That's usually what it is. You know, or they want to have it both ways, which is I want to do my best, but I want to party my brains out also. And it's kind of like, I'm sorry, you cannot have it both ways. It just does not work that way.
Interesting, though, there are a lot of college students who are still on some of these medications since childhood. And you think that maybe once you enter college or even high school, you should check and see whether that's still needed for the child.
Well, yes, a lot of children age out of these diagnoses. The other issue is this is really a specialist diagnosis, and sometimes, in fact, fairly frequently, studies show kids end up with an ADHD or ADD diagnosis through their pediatrician. And if you can manage it, you really ought to get a referral to a child psychiatrist who specializes in this area, because this is not an uncomplicated diagnosis. And if you're looking at starting your child on medication, you really should, make that referral and make sure that's really what's needed.
Yeah, that's good advice, Ed. As always, thank you for opening up our eyes as parents. Thanks.